Today we're going to talk about case acceptance. How can we gain more case acceptance for your patients? So there's a lot of things that are involved in here, and it doesn't matter what plan it is that you are presenting to your patients. It doesn't matter how much it is. What it matters is how it's being presented to a patient. So your cases can be anywhere between a few $1,000s to 50, $60,000, depending on how much you're doing in your office. But no matter how much it is, the way that you're presenting it to your patient is like it's $5. So you got to have that confidence when you're presenting, and you got to have the knowledge when you're presenting. So most of the office that I go to, the front desk is presenting the plans to the patient, which is fine as long as there's a few things that are done prior to this happening. One, when a patient is going into the room and they're taking off their overcoat of fear of how much it's going to cost for this plan, what is this office going to do, is it going to work, is it going to fail, are they really ethical, are they honest on what they're doing, all this stuff going through their head. What you really need to make sure that you're doing is, one, the assistant needs to be kind, caring, compassionate. The assistant needs to talk to the patient, build a relationship with the patient, not leave the patient alone in the room. Have tools, models, videos, photos, have these things to educate your patient. You have to have a consistent new patient structure. So they come in, they have 10 minutes to be at the front desk, go to the bathroom, turn in paperwork. They go to the back, they get x-ray, photo, CAT scan, whatever it is you need. They get medical history review. They get some education. What are you here for? What is it that you need? What is it you want? They get that from the patient. The assistant should be educating a little bit, educating on what they see on x-rays, photos, giving some options, not diagnosing what they're seeing so that they can pre-educate, warm up the patient to what you're going to diagnose when you go into the room. Brief you, leave the room, get the doctor to assure doctor gets into the room on time. Don't have your patients waiting. They're busy, just like you're busy. They want in, they want out, they want to know what's going on. Get the doctor briefed. Why are they here? What do you have? What do you think that they're feeling? Fears, barriers might be, whatever that. Get the doctor into the room, have the doctor do their thing, introduction, warm up with the patient, do the full examination. This is what I found. This is what I see is needed. Here's what I would recommend. This is what you're going to get from the treatment. This is the time frame I need you to come back and have this done because of this. Urgency, value. Really make sure they understand. Do you have any questions? When do you think you can schedule for this? You're concerned about the infection, the bone loss, whatever it is. I'm not saying put fear in. I'm not saying fake it. But really, for a lot of your cases, there's something that you can get them back and for of an urgency matter. Be sure you express that. Make sure there's no questions before you leave the room. Before you actually talk about what is needed, here's what I would recommend, and here's what I found. Get the person who's going to present the plan to the patient in that room. The treatment coordinator might be your front desk person. Do some sort of intercommunication, whether it's Blue Note, a Dentrix notification, whatever it is, a light on. Treatment coordinator comes into the room, is standing there. This is Tana, this is my treatment coordinator. She's going to be the one that's presenting your case today. I'm just going to talk to her about what my findings are. Tana, this is what I found today. This is what I recommend. This is what I would like for her to do. If she can't do that, we can do this. However, she does need to know this and this. Talk to the treatment coordinator in front of the patient about what you want that patient to know. Then you guys, treatment coordinator, doctor, ask questions. Do you need this? Do you want this? How much time? Just ask the questions. You're doing it, one, because you need to know, to schedule, to collect, so on and so on. And two, you want the patient to know. You need to reiterate this sometimes in 3 different languages so the patient can really understand what's needed to obtain what they came into the office to get. So be sure that the assistant is not leaving the room, giving it to the person at the front desk, the patient's going back to the front desk, and now this person's asking for money. You're not going to get a lot of acceptance that way. You probably get lucky and get some patients who just are really, really ready, but it's not the best way to do it. So get the treatment coordinator in the room. For the treatment coordinator, best way for you to get a case accepted is not to present a number to the patient, 5,000, 10,000, 20,000. It's to present options, a way the patient can pay. This doesn't mean that the patient doesn't have money and needs to find a way to pay, although it might. There's a lot of people that have a lot of money and don't want to let go of it. So it's the easiest way, the most comfortable way that you can find for them to hand over their money. So the way we do it here is we offer 3 different payment options when I present. This is what the doctor has presented today. The doctor has presented this plan today. This is what he wants, and this is what it is. He wants to extract that tooth, it's infected, clean out the infection, make sure it's a clean field, place that implant in that area, wait about 3-4 months or so, and then go back in, we're gonna uncover it so we can expose that implant, and that way your dental dentist can put a nice, beautiful, healthy crown on that tooth. Everything together comes to here. Everything comes to $5,428, and there's 3 different ways that you can pay that. You can either pay in full today and you get a 5% discount. That will save you $270. If you don't want to do that, you can do a deposit today. We'll collect a deposit of $500 today. We'll get you scheduled, get the pre-op done, and then when you come in for the procedure, then we'll collect the rest on that day. If you don't want to do either one of those, we do have a few finance companies. We have Care Credit. Everyone has Care Credit. Not everybody. Most people have Care Credit, or they've used Care Credit. We have Care Credit. Care Credit is like a credit card that you apply for, and you can use it for any dental treatment today, or it continues to be your Care Credit credit card. You can use it for cleanings and other stuff that you come back for. If you don't want to do credit card financing like that, you can do a payment plan. We do offer a payment plan. We use a company called Cherry that helps us with our payment plans, and it allows you to just make comfortable payments on this without doing any financing. What's the difference? Big difference. Let me show you something here. So the reason why we love Cherry is because Cherry is different. It is not a finance company. So I put together this little paper that we have as far as what makes this payment plan better. And the reason why I'm sharing this with you today is because we use Care Credit Lending Club Green Sky forever and ever and ever. And we are able to get some people finance for it, but a lot of patients don't like financing. They don't want to finance. They don't want to go through the credit hit. They don't want another credit card. They don't want anything of this. Even though there's an interest-free option on it, they don't want it. They do like payment plans. So we have had a huge increase in our acceptance just simply adopting Cherry Finance or Cherry payment plans that offers your patient a soft check on their credit card, a soft credit check, and they can now make comfortable payments to you without doing financing. So I asked my girls, my treatment coordinators, what do you love about Cherry? And why are we using so much Cherry? What is it? And they said, the patients love that it's a soft check throughout, so it is not a hard hit. The loan amounts are anywhere between $200,000 and $35,000. That's a lot of money. They approve down as low as a 520 credit score, which is good because a lot of people have overextended their credit. They don't have a very big credit score, so 520 is pretty good. We have yet to this day, we've been using it for a year, have a denial, and that's pretty good. Anybody out there who has run Care Credit Lending Club, Green Sky, you know you get quite a bit of denials. We haven't gotten one yet with Cherry, so that says a lot because we see 28 new patients a week. Prime credit payments qualify for 0% plans, which is good. Patients like that. 60-second approvals allow for same-day treatment, very quick to get that approval. No retroactive APR, transparent loans, no surprises. So what that means is anybody, again, who's done Care Credit, if you do a 12-month interest-free for your patient and the patient goes to 13 months and didn't finish paying for that, they get retroactive all that APR for the last 12 months. And that's a big, huge hit of a payment to pay. Patients are not happy. If they're not happy with Care Credit, they're not happy with you. Cherry doesn't do that. So no retroactive APR. The interest rates are better for patients and they're better for you, but they're better for patients. There's a payment estimator, which is excellent. this payment estimator, which I'm going to go through here and find. So you can do this as soon as your patient sits down, before your patient even sits down and you do the case presentation for your patient. You can give them this paper, and it's called a payment estimator. And what this is the payment estimator will show the amount of the treatment, how much it is per month, and break it down to 3, 6, 9, 12, 18, or further if you want a further interest-free plan. But we only go to 18 months because that's where it is line by line exact with care credit, but giving them a longer frame to pay that. And the rest we have 24, 36, 48, 60 with interest if they choose to do that for a lower payment. So you can have this ready for them. This is a paper that gives them a solution. This is how they can pay it. Most patients, I have yet to do an interest-bearing one, but it's there with lower payments if they want to. This one allows for them to have up to 18 months interest-free on their payments to do this financing. So they do love that. So also what patients love about this is they can use their credit card to pay this. It's a payment plan, not a financing. So they can use their credit card to make their payments. So they can use their Sky Miles, their points, they can use all that. They can use their credit card. When you are doing the financing, if they choose to do the payment plan, right then and there, when they get approved for it, they have to make their first payment. So the first payment is done in the office that day, and then they do it for every month. But again, they can use their credit card for that. So they like that. They enjoy that. And it's great. So what is great about Cherry for you, for your office? The great thing for you is it's a simple application that doesn't take up much staff time. We can do it quick. Merchant fees, 20 to 30% lower than traditional merchant fees comparable to credit card transactions, even on the 12, 18, and 24-month interest-free. So for us, the 18 months interest-free is the same that we were paying for the 12-month on care credit. So we can do a longer time for our patients and pay less using Cherry. So it's better for us, lower rates. It funds the practice in 1 to 2 days so that we can get our money fast. It does increase our acceptance rate. It has really bumped up our acceptance rate. The treatment coordinators love it. It's easy, it's fast, and they get the approval. And because we're confident in it, and we know our patients are going to love it. They love using their credit card. They love the interest-free. They love how fast and easy it is. They love that it's a payment plan and not a finance company. We get better acceptance. Referral bonus. If you refer another office, they give you a referral bonus for it. There's no minimum usage or enrollment fees, and the payment calculator makes it easy, which I just showed you. So these are the talking points, and I can include this onto this video if you want these talking points on here. I can go on ahead, you can screenshot, zoom in, you can also look at it that way. The patients, when they do accept and want to do it, they also get a nice little email from Cherry. And then the email does go over everything for them to show them, hey, congratulations, you now have this. This is your loan. This is what your options are. So it's great that they can do that. They get that nice little email on that. So what you're doing to increase your acceptance in your office is you're providing your patients a way that they can accept, afford, be comfortable paying for the plans. You make sure that your treatment plans are well spelled out, where they know everything that is going to be coming on. So they have everything. They have all the payment. Make sure they're correct on. So they have everything that's going to be done. They have all their options lined up. We have the total amount due. We have their responsibility. We have our disclosures. We have our options. You can pay today, 5% discount, save $700. You can pay in phases, do a down payment today. You can do a payment plan, or you can use one of our finance companies. Any of those that you want. We break them all down. What happens when you do that is the patient focuses on different ways to pay for it. They don't focus on that big number. Now they're like, okay, I've come to an office. I'm finally able to get the smile I want, the chewing capabilities that I want, and here is a way that I can afford it. So if you're looking for a way that you can increase your acceptance, give your patients options, give your patients ways that they can afford to do treatment in your office. Now, for Cherry, they do have, let's go down here. Cherry does have this little tier, system, and now it's sideways, and I do apologize. But they have a bronze tier, they have a silver tier, and they have a gold tier. Gold tier is the best. So if your office is bringing in over $30,000 a month in Cherry payment plans, you will be at the gold tier. As you can see here for the gold tier, if you do a 3-month, you're paying 1.9. 6 months, you're paying 2.9. 12 months, you're paying 6.9. 18 months, 9.9. And 24 months, 11.9. That's your rate to pay. That's a lot cheaper than what Care Credit has at the gold tier. If you do silver, it's still better. And if you do bronze, it's still better than what the Care Credit is for you, for the practice to pay out. Now, great thing with Cherry, I've called them and say, hey, I have some clients that would love to hear about Cherry. If you're interested in adding Cherry, our rep, wonderful, we'll do a quick little conference call with you and show you how Cherry can work for your office. So what you can do is you can go to withcherry.com/IDS. What this will do is it will allow you to sign up to do this. It's like 15 minutes or so, show you what Cherry financing or Cherry payment plans, saying that, can do for your practice. And if you use that link, they will automatically start your office off at gold. Now, if you do this on your own ordinarily, or the way everyone else does it, it will start you out at platinum, which is a higher rate that you pay. And doing it this way, you start out on the gold tier. Starting out on the gold tier gives you the best fee, the lowest fees to pay in your office. And that way you can start benefiting from those low rates right away. So it gives you 2 months to start using it, getting in that constant flow of $30,000 of financing per month, and keep that low gold tier. You can keep it and save your office a lot of money, save your patients a lot of money, and get a whole lot more acceptance. If you have any questions on Cherry, what Cherry can do for your office and for your patients, what's the difference between a payment plan, Cherry, and finance companies like Care Credit, you can always email me at Danielle@directorofdentistry.com. That's DANYEL@directorofdentistry.com. And I would love to help you to show you what Cherry can do, or just click on that link with cherry.com/IDS and schedule that consultation with the representative, and they can show you exactly what Cherry can do for your office. You guys have a great day. Thank you.